fraud and other threats to Medicare. Last week, when the Department of Justice charged 3 people in Miami with fraud and other crimes in a $1 billion scheme to bilk Medicare, it was the single largest criminal case in the 9-year history of the Medicare Fraud Strike Force, a coalition of federal, state and local law enforcement agencies. A month earlier, a crackdown by the strike force led to civil and criminal charges against 301 people in dozens of schemes totaling $900 million in allegedly false billings. Clearly, healthcare fraud is vast. Less obvious is that prevention, detection and punishment of fraud have improved in recent years, though that would be threatened if the Affordable Care Act of 2010 were weakened, as Republicans have long demanded. Obamacare provided an additional $350 million to expand the Medicare fraud strike force to 9 cities, from only 2 in 2007, and to develop advanced data and accounting systems to uncover fraud. The law also toughened sentencing for Medicare fraud, in part, by clarifying that prison terms are to be based on the falsely billed amounts, not the amount actually paid out before the fraud was detected. To date, some 2,000 of 2,900 defendants charged with felony healthcare fraud in strike force cases have been convicted. Most have been sentenced to prison, not merely probation. In addition, courts have ordered defendants to repay the government more than $5.5 billion, which is about the total amount the government paid out in the frauds that have been prosecuted.